Hello and welcome to everyone. It's great to see so many people here in this lunchtime seminar. It's my great pleasure to introduce my colleague and today's speaker, Amy Milton. Amy is a behavioural neuroscientist and senior lecturer in the Department of Psychology here in Cambridge. She's also the Pereiras Willits Fellow in Neuroscience at Downing College. Amy's research focuses on memory, and in particular the consolidation and reconsolidation mechanisms underlying different forms of memory. Amy's research is unique in forming bridges between basic neuroscience and various neuropsychiatric disorders, including post-traumatic stress disorder and addiction. I guess we'll be hearing more about that in Amy's talk today. And just by way of further background, Amy completed a natural sciences degree in neuroscience at Newnham College. She later studied for a PhD in behavioural neuroscience with Barry Everett, who's here in the virtual audience. That was in the Department of Experimental Psychology, it was known then. And she now heads the Memories and Neuropsychiatric Disorders Lab with the lovely acronym MIND. So Amy, over to you. The title of the talk is there, Challenges and Opportunities in Exploiting Reconsolidation to Treat Mental Health Disorders.
Great. Well, thank you for the nice introduction, Jeff, and thanks for the invitation to speak as well. It's a real pleasure to be joining you today. So I probably don't need to make the case to this audience that mental health disorders are a major problem for medicine. You're probably all very aware of these very sobering statistics that Europe-wide it's estimated that 38% of people are currently experiencing mental health disorders, and that of those 38%, 35 to 50% of those are currently not receiving any form of treatment. Now, treatment is not always readily accessible. Of course, treatments are available, whether those are pharmacotherapies or psychological therapies, but not always readily accessible and not always easy for patients to adhere to or to complete. But even in the case where treatment has been accessed, where treatment has been adhered to, even where that treatment has been initially effective, relapse is still depressingly common. So for psychological therapies, it's estimated about 50% of patients will go on to relapse within a relatively short time period of a year or so after completing therapy. It's also the case that our understanding of the mechanisms that underlie current therapies, particularly psychological therapies, but also to some extent pharmacotherapy as well, are quite unclear. And this limits us in optimizing those treatments and also in stratifying them so that they can be targeted to the people who would most benefit from a specific type of treatment. So it's clear, I think, that although there is a lot that can be done for a lot of people with mental health disorders, there's still a great unmet clinical need and a real need for treatment innovation. Now, there seems to be a trend, I think, in the development of treatments for mental health disorders in trying to develop treatments that have a relatively punctate administration, but will have long-term impacts on patient outcomes. And if you were at Robin Carhart-Harris's talk a few weeks ago, you'll have seen that kind of strategy being applied in his psychedelic work, a relatively short-term intervention under a psychedelic with the intention that that would have a very long-term impact on the patient's mental health. And another approach that is similar to that in terms of punctate treatment episode followed by long-term follow-up and benefit to the patient is the potential for targeting memory reconsolidation. Now, I should be very clear when I talk about memory reconsolidation in this talk, I'm really referring to emotional memories, so associative, implicit, unconscious memories that influence behaviour. Now, these are relevant to many different mental health disorders. Post-traumatic stress would be an obvious example where trigger stimuli are able to induce psychological distress and other symptoms of PTSD. But actually, I'll be focusing mostly on addiction in this talk. And in addiction, similarly, maladaptive memories can contribute, particularly to the precipitation of relapse when someone is trying to maintain abstinence. And of course, the acts of drug seeking and drug taking in themselves are maladaptive instrumental memories. I'm not referring, though, to autobiographical or episodic memories, which is what we normally think of when we think about memory. So I should just be very clear that I'm referring to these kind of emotional associative memories that have long-term impacts on patient behavior, and often in a way that is not necessarily accessible to consciousness. Now, many of you will be familiar with the basic concept of reconsolidation, so I'll just recap it quite quickly here. But essentially, what the reconsolidation theory says is that we should let go of this idea that memories exist in short-term and long-term stores. But actually, we should think about memories more in terms of their activity states. So to borrow Lewis's terminology, we can think about memories as being in either active or inactive states. So once a memory has been made or consolidated, it enters this inactive form, which is quite stable and persistent. So it's relatively similar to sort of traditional concepts of long-term memory. But differently to the traditional view of memory, memories can move from this inactive state back into an active state, which is far more transient and malleable. It's modifiable when it's in the active state. And it does this through a process that we refer to kind of procedurally as reactivation, but more mechanistically as destabilization of that memory. Now, while the memory is in the active state, it's hypothesized that reconsolidation has evolved so that memories can become updated. So new information could be incorporated, the memory itself could be strengthened, and that memory would then restabilize or reconsolidate back into the inactive state in its updated form. Now, this process was originally described in the 1960s, but kind of fell out of favor for a couple of decades and was revived by Karim Nader, working in the lab of Joe Ledoux around the turn of this century. Now, what Nader showed was that consolidated fear memories, if they were reactivated through re-exposure to the cue in the absence of shock in this case, as they were fear memories, if they were reactivated, they could become once again sensitive to protein synthesis inhibitors. So it was necessary for the memory to undergo an additional round of sort of restabilization and synaptic plasticity processes in order to persist in the brain. And so animals that had undergone reactivation followed by this amnestic treatment appeared to have no memory of that prior learning when they were tested subsequently. This is essentially an idea that's then been put forward for mental health disorders. It didn't take long for the field to realize that if you have these maladaptive memories that contribute to mental health disorders, then if you could get those memories, those old well-established memories, and get them to convert from the inactive to the active state, and then block that reconsolidation process with the use of an amnestic agent, it should be possible to trap the memory in the active state, where it is short-lived and unstable. And so at the very least, you could weaken, and in the strongest versions of this theory, actually erase those maladaptive memories that are having such an adverse outcome on patient behavior. And so we and others, so Barry Everett and I wrote a perspective piece on this, a review in EJM back in 2010, arguing that this kind of approach could be used for addiction. Jane Taylor, Mary Torregrossa have made similar sort of arguments for addiction as well. Meryl Kint in particular, Emily Holmes have argued for the use of these kinds of therapies in the treatment of PTSD. So reconsolidation really does present us with the opportunity for a relatively short-lived therapeutic intervention to have a really long-term effect on patient outcomes. But these studies were quite some time ago, and it's become clear sort of every time that a new reconsolidation study, sort of particularly when it makes it to humans, comes out to the media, there's great excitement about, you know, forgetting pills and erasing memories, and, you know, the Daily Mail with typically measured response, you know, talking about research that threatens human identity. I mean, these are all from 10 years ago. There have been some recent headlines as well. So Alan Brunet's lab have been trying to use reconsolidation-based approaches to help with memories of bad relationship breakups, Very Eternal Sunshine of the Spotless Mind. Steve Marin's recent paper looking at indirect reactivation of memories has also sort of garnered some press interest. But for all of that time, we're still at the point, sort of 10 years on, where we haven't yet made that step to getting to a point where reconsolidation-based intervention could really be tried in large-scale clinical trial. And so there clearly are some challenges, not least, I mean, there have been recent failures to replicate, which I'll come on to shortly. But essentially, yeah, we are not quite there for clinical trials yet, leading to headlines like this rather charmingly blunt one from Psychology Today, that actually erasing memories might be difficult after all. And I think it's clear, because of the time lag, that there are clearly some challenges in translating reconsolidation to the clinic. But I am ever an optimist, and I think these are challenges that can be overcome. So what I'll be talking to you about today are what I consider to be some of the major challenges, and then some of the steps we are taking to try and address those. So I will be talking about ongoing work here today. There aren't necessarily complete stories to be told for all of these, but hopefully it will give you some idea of what the challenges are and the direction we can head in to try and overcome those. So thinking about challenges, I'm actually going to set aside the difficulties of animal to human translation, because I think it's an important conversation, but it's potentially one that we could have in the questions. I do appreciate that humans are not just rodents with big prefrontal cortex, but a lot of the emotional memories that we're talking about in these reconsolidation studies are highly conserved in terms of the psychology and the underlying neurobiology. So actually, I think you are on pretty good translational ground when you're thinking about translating from rodent studies to human studies, and there seems to be quite high conservation across species. The challenges I'm going to focus on are essentially threefold. So the first major challenge, I think, is working out how to reliably destabilize memories, and I suspect that this is where some of the failures to replicate have come in. The second major challenge, I think, is focused on restabilization of the memories, and it's particularly identifying amnestic agents that are safe for use in humans. Now, I think that this one has been considered a major challenge for quite a long time. I'm going to make the argument it's not necessarily as great a challenge as we initially thought, and partly that's because of the third challenge. The fact that there are some behavioural methods that can also potentially be used to exploit reconsolidation. But the challenge there, I think, is actually really understanding what the underlying mechanisms are so that they can be optimised for patient use. So to begin with destabilisation, I am going to summarise about 10 years of work across a number of different labs in a couple of slides. So this is going to be necessarily brief, but if anybody is particularly interested in the topic of destabilisation, I'm very happy to provide references and have a fuller conversation about that in the questions. What do we know about memory destabilisation? Well, we know that destabilisation of memories doesn't occur every time a memory is retrieved. We know that retrieval and destabilisation are two separate processes. And we know that there are specific conditions which are often referred to as boundary conditions that determine whether a memory destabilises or not. Now, these have mostly been worked out for Pavlovian memories, and the first study really looking at this was one from Maria Petrera and Hector Maldonado working in crabs in Transmagnifus. And they identified back in 2004 the importance of inducing a violation of expectations, or surprise essentially. By surprising their crabs, they were able to induce old memories that undergo reconsolidation and become susceptible to disruption or to update. Now, of course, that makes sense, particularly if you think about it more formally in terms of prediction error. Exactly the situation where you would want to update a memory is where there is some kind of violation of expectation. So we know that inducing prediction error is important. We know that in the presence of new information is also very important for engaging memory reconsolidation. But I should comment that the relationship between prediction error and memory reconsolidation is not monotonic. In fact, it's actually quite complicated. As became clear when Emiliano Merlot was doing his postdoc in Barry Everett's lab, there is quite a complicated relationship between prediction error and other memory processes, including reconsolidation and extinction. So typically, to induce the destabilization of the memory, to reactivate it, what you will do is you will present a brief number of exposures to the memory, the reminder cue, and then you will target with your amnestic agent. So if we take, for example, a study of Pavlovian fear memories, animals learn to associate a tone and a shock in training. That memory is allowed to consolidate, and then we reactivate that memory by presenting them with 1 or 2 re-exposures to the tone on its own in the absence of the shock. And we know when we do that, that this engages prediction error, and we know that this also engages the reconsolidation process. However, if we were to continue presenting the tone in the absence of the shock, so let's say that we go up to 10 exposures to the tone, for example, then actually what we engage is not reconsolidation. We actually, as we increase the amount of prediction error, start to engage a completely different memory process of extinction. And extinction is, in fact, new learning, inhibitory learning that competes with the original memory for behavioral expression. It doesn't overwrite or edit the old memory. So the old memory is still there. And with time, with changes in context, with reminders, that original fear memory will come back to dominate behavior again. So it's clear that the relationship between prediction error and reconsolidation is not monotonic. And in fact, what you have is, as you progressively engage prediction error, you not only stop reconsolidation and begin extinction, you actually hit this period which Emiliano termed the limbo, a period of paradoxical stability where reconsolidation is not being engaged, but extinction is not yet engaged. And so that's what I suspect actually probably underlies some of these failures to replicate. That without realizing it, the memory is being induced beyond the point of reconsolidation and actually into the limbo period where any amnestic agent is no longer going to be having any effect. So we need prediction error, that's clear. It's not necessarily a straightforward relationship, but prediction error is important for inducing destabilization. We also know, however, that the degree of prediction error that is required also interacts with the strength of the memory and the age of the memory. So it's not necessarily the case that there is a single recipe for memory destabilization. It depends very, very much on the training history and the experiences of the individual. So it's a challenge in the lab. It will become more of a challenge in the clinic where every individual has a unique life experience that has contributed to the mental health disorder in question. Now, that is true for Pavlovian memories. What about instrumental memories? Because we know that in addiction, for example, both Pavlovian and instrumental memories are contributing to the behavior. So in practical terms, when we're reactivating a memory in addiction studies, so this is an example from a study I did when I was a postdoc with Barry Everett back in 2008. Here we were looking at rats that had been trained to self-administer cocaine in the presence of a Pavlovian cue. They had then subsequently been reactivated for that Pavlovian memory under the influence of an NMDA receptor antagonist, MK-801, or control vehicle, and then they were subsequently tested off the drug in an extinction test conducted 72 hours later. And what you can see here is that animals that were receiving saline at reactivation show a very, very nice reinstatement, as you would expect. They reinstate more than animals that had no Pavlovian cues presented in the test session but had previously received saline at reactivation. And the animals that received MK-801, the NMDA receptor antagonist at reactivation, show levels of responding that are lower than the saline group and actually not statistically different from the group that had the CS emitted completely at test. So this suggests that the MK-801 has impaired or weakened the influence of that Pavlovian cue over the drug-seeking behaviour. But what is also clear from these data is that the instrumental memory relating lever pressing and the drug remains intact. Because for all of these animals, regardless of whether the cue is present or not, they respond more on a lever that used to be paired with the drug, the active lever, than a lever that was not paired with the drug, or the inactive lever. So the instrumental memory has not been impaired by the destabilization or the reactivation procedure used to destabilize the Pavlovian memory. And it turns out actually for a very long time that it was assumed instrumental memories didn't destabilize at all. But some work that came out of Jonathan Lee's lab a few years ago suggested that in fact they do. Now, we were interested in this question at the same time as Joff. We took a different approach, and our first experiments didn't work, but you'll see where we've gone with this subsequently. So that our first attempts to try and get instrumental memories to destabilize were essentially based on applying the same sort of approach as we'd applied with Pavlovian memories. So I just explained how a single cue re-exposure in fear learning can engage reconsolidation, but 10 re-exposures, for example, engages extinction. So what we did in this first experiment, which was done by Craig Burns when he was a graduate student in the lab, was to train animals up. This is animals working for chocolate pellets on interval schedules. The animals were trained to work for these chocolate pellets. So an instrumental memory is forming. We then gave them different lengths of re-exposure with the idea that hopefully we would engage extinction with longer re-exposures, reconsolidation with shorter re-exposures, and hopefully see a nice limbo period in the middle so that it would be analogous to those Pavlovian experiments that we'd done before. However, what became apparent when we looked at the data from the test session, so again, I should clarify, the animals are not under the influence of the NMDA receptor antagonist here, MK801. This was applied around the time of re-exposure, and then they subsequently tested off drug. But what you can see is that with these long reactivation lengths, we did indeed engage extinction, because you can see the responding has gone down in the vehicle treated animals, and the extinction learning itself was blocked by the presence of MK during that re-exposure session. But actually we failed to engage reconsolidation at all. There's no evidence, even at very short 1 minute re-exposures, that we've actually engaged reconsolidation. So it turns out, following on from Joff Lee's work, this was completely unreinforced re-exposure, which is standard for Pavlovian memory destabilization, but is not possible. It doesn't work for instrumental memories. And in fact, the approach that Joff took, working in Birmingham, was quite different. What he found essentially was that the predictability of the reinforcement schedule seems to be really key for instrumental memories. So you have to have reinforcement. That seems to be really important. But the predictability of the schedule is absolutely key. So he took animals that were trained on a very predictable fixed ratio 1 schedule during training, and then at reactivation put them onto different reinforcement schedules. Now, what he found was that if you move animals from one predictable schedule to another predictable schedule, so FR1 to FR20, you don't actually engage destabilization of instrumental memories. But if you move them from a predictable to a less predictable schedule, so from a fixed ratio to a variable ratio schedule, then you do see destabilization of the memory, and you see amnesia with the administration of MK801. So we first attempted to replicate this and then tried to extend it. And so what we did was we took animals that were trained, again for chocolate pellets, on FR1. We then reactivated the memory under different conditions, and then we tested them off drug. And again, we're using MK as our amnestic agent. And what we found, first of all, was a replication of Joff Lee's data. So moving the animals from one predictable schedule to another different predictable schedule didn't seem to induce destabilization or sensitivity to MK801. Moving them to an unpredictable schedule of VR20 did. Non-reactivated animals showed no effect, which is always reassuring. But something that we found, which was particularly intriguing, was that if you move the animals to a schedule that is too unpredictable, so in this case, a random ratio 20, so the same overall levels of reinforcement as your VR20 and your FR20, but far more unpredictable because the schedule is reinforced probabilistically, that didn't induce destabilization of the instrumental memory. It seemed like the schedule was too unpredictable in order to engage deep memory destabilization. So this is an ongoing story. So we've looked at a number of different things, and I think we're still kind of figuring this out. But to sort of summarize some of the conditions that we found. So this was a separate set of studies, so different data. Again, we find, non-reactivation, reassuringly, there's no effect. Again, we replicate this VR20 effect. What we started to do then was to vary how predictable that VR schedule was. So animals in the Lee paper were actually responding between 12 and 28 times on average in order to be reinforced. So we made that schedule a little bit more predictable by making it 15 to 25. We still saw the effect, but when we made it far more predictable by restricting that variability just to 2, so 19 to 21, there was no effect at all. So it seems like there is a sweet spot of variability in the schedule that actually determines whether the memory destabilizes or not. But it's not to say that variability is everything, because we also found that if we took this ineffective FR20 schedule, that increasing the number of reward pellets given using that schedule, so that's what FR20 times 4 refers to here, that did induce destabilization of the instrumental memory. So there is clearly some kind of interaction between the variability and the predictability of the schedule along with prediction error. And it has to be behaviorally contingent. So when we conducted an experiment where we controlled for the same overall level of reinforcement but made it non-contingent on behavior with a random time schedule, then we didn't see destabilization. So I don't yet have a full account of these data, but it seems to me that if we're going to overcome this challenge, particularly from the perspective of instrumental memory destabilization, we need to be going beyond prediction error in and of itself, and we actually need to be starting to bring in some predictive coding type analysis to understanding what is happening in that reactivation session. We are still having to violate expectations of the organism, but that means we need a better understanding of what the internal model is and how the current evidence that is being presented to the animal is being weighted, and how far is too far away for that to be considered updating of an old memory versus formation of a new memory. So I think there's sort of some very interesting theoretical approaches that could be taken there. Now, the talk is actually more about translation. So whilst these theoretical approaches I think are really, really important, I'm really interested in that. From a more practical level, of course, we are looking at other possibilities. So one thing that we're trying to do in the lab is to find markers of destabilization. Again, this is ongoing work, and of course for us this is all post-mortem brain tissue. But essentially what we're looking at are independent molecular markers that destabilization is occurring, such as degradation of synaptic density proteins like pan-shank or shank more generally, and using those to verify whether a particular reactivation session has destabilized a memory or not. And I think that will be particularly important for interpreting those failures to replicate reconsolidation effects, because if we can prove that destabilization isn't occurring, that then gives some context for those failures to replicate. Now, of course, if this was going to be taken forward into the clinic, ideally what you would want, and this is very blue skies, but ideally what you would want is something like neurofeedback, where you could actually determine some form of a signal that would show that a memory was currently in a state where it was destabilized. Now, this is very, very blue skies thinking. It's something that I've discussed at length with Ravi Das and Emiliano Merlo and Tristan Beckenstein. Ultimately, this is where we would like to go, but I think, we're a long way off that just yet. So destabilization is a challenge, but I think we can overcome it, and we're taking a number of different approaches to try and address that. The second challenge is identifying analystic agents that are safe for use in humans. And this was considered a really big problem when reconsolidation was kind of gaining steam in the early part of this century, mostly because a lot of the drugs that were being used were being targeted to specific brain regions directly, so intracerebral administration, and were drugs like protein synthesis inhibitors that are not readily cannot be readily administered to humans. But that said, there are a number of options, I think. So one drug that has been used quite extensively in the reconsolidation literature is the beta-adrenergic receptor antagonist propranolol. So we've used this, I've used it in my own work as a graduate student with Barry Everett, where we found that administering propranolol at reactivation of a cue cocaine memory could then prevent that cue from acting as a conditioned reinforcer subsequently, even if you test the same animals for up to a month post that one administration of propranolol at reactivation. Moritz Schramm, when he was a graduate student with Barry and I, did the same sort of experiment for alcohol, and notice the difference in scale here because Moritz's data was quite variable, but you can still see the same overall effect, that at least there is a weakening with propranolol. Now, other labs, including the lab of Lin Lu, have subsequently gone on to show that propranolol can disrupt the reconsolidation of nicotine-associated cue memories in both rats and in humans as well, can actually reduce nicotine craving in human smokers. So actually, propranolol does, I think, have some value as a potential amnestic agent. I mean, we've always personally found better effects of NMDA receptor antagonists, which is why we go back to them as our amnestic agent of choice over and over again. And we found, again, I won't go through these data in detail because they're all published, but essentially what to take from this slide is that we found that NMDA receptor antagonism given at memory reactivation can interfere with the ability of a Pavlovian cue to influence instrumental behavior in many different ways. So whether that's through conditioned reinforcement, conditioned approach, or conditioned motivation. And although when these studies were published, there was sort of great criticism that you can't use NMDA receptor antagonists in people, I think the more recent work looking at ketamine as a rapid-acting antidepressant and some of Ravi Das's work using ketamine to target these kind of Pavlovian memories in hazardous drinkers actually again is making this look like it may in fact be a little bit more feasible. So I'm not saying that this is not a challenge, there is still work to be done here. But I think that finding an amnestic agent that's safe to use in humans is possibly less of a challenge than it was thought to be sort of 10 years ago. Now, one other thing that sort of feeds into that is the idea that you may actually not need to use any kind of pharmacotherapy to manipulate reconsolidation anyway, because there are in fact behavioural methods that could potentially be used to exploit the reconsolidation process. So probably the most extensively studied of these is a phenomenon known as extinction within the reconsolidation window. This was first described by Marie Monfils, again working in Joe Ledoux lab, and I should just put in a little plug here that Marie will be speaking at the Zangwill seminar series on the 14th of May. So if you would like to hear about this research from the person who did it, then I'd highly recommend that you come along to that. But essentially what Monfils reasoned was that if reconsolidation has evolved for the purposes of updating, then it should be possible to introduce new information into the memory following its reactivation. Now, we know, of course, as I've described before, that extinction learning is not overwriting of an old memory, it's the formation of a new memory. So typically what you would have, and all of Marie's stuff was fear, so I'll stick with a fear example here. Animals acquire a fear memory. After this is consolidated, they extinguish, which forms the inhibitory memory. And then with particular, reminders, shocks, or changes in context or changes in time, the original memory wins the competition again and the original memory becomes expressed. But what Monfils reasoned was that if you could induce the memory to destabilize, so if you could open the reconsolidation window, and then do your extinction training within that reconsolidation window, it should be possible to effectively overwrite the original memory with this new cue, in this case, tone safety information. And that should lead to a memory that doesn't show these classic phenomena of extinction learning, spontaneous recovery, reinstatement, and renewal. And in fact, that is what Marie observed in her rats. So across different measures of sort of fear recovery, she saw no evidence for this in her animals that had undergone this retrieval extinction procedure. And Daniela Schiller subsequently showed the same sort of effect in humans, which seemed to persist for up to a year. Although I should also draw your attention to Tom Becker's recent work, which has been questioning some of those conclusions. Now, remarkably, shortly after these papers were published, another paper came from Lin Lu's lab, a real tour de force of a paper, so I highly recommend reading it, where they looked at the possibility of using this retrieval extinction procedure to affect relapse measures in rodent models of addiction, but also in outpatient heroin users. And I'm just going to talk about the heroin user data for this slide. So essentially what they were doing, so here we have some baseline data, and as you would predict, heroin users show great increases in cue-induced craving when you present them with heroin-associated cues. What they then did was they split their sample into three. So a group that would undergo just standard prolonged exposure therapy, which we know is not particularly effective for addiction. A group that would undergo a brief drug memory retrieval, followed by a short delay, 10 minutes in this case, and then prolonged exposure therapy, so extinction within the reconsolidation window. And another group who is shown in yellow who underwent the same brief drug memory retrieval and prolonged exposure therapy, but with a 6-hour delay. So that would be extinction outside of the reconsolidation window, because the memory would have destabilized, but restabilized before those 6 hours had passed. Having done those manipulations, they then went on to look at the impact on craving, which they measured up to 6 months later. And remarkably, they found that this retrieval extinction procedure, which, bear in mind, prolonged exposure doesn't work for addiction, just introducing this 10-minute delay was enough to make the procedure effective. And these retrieval extinction patients showed markedly reduced craving that persisted for at least 6 months after the intervention. So of course, these data are absolutely staggering, but obviously you always want to check that you can replicate these things. So when Tony Farragut came to the lab as a postdoc, one of the first things that he set out to do was to see if we could replicate the Lin Lu data for the rodent side of that paper. So Tony took animals that were trained to self-administer cocaine, and this is both Pavlovian and instrumental training. And then he essentially replicated the experimental design that you just saw for the outpatient study. So some animals underwent a reactivation procedure with a 10-minute delay and then extinction. Some underwent the same reactivation with a 6-hour delay and then extinction, and some just underwent extinction training. They were subsequently tested for cocaine-induced reinstatement and for spontaneous recovery of the cocaine memory. And what we found, and we were amazed to see this and sort of delighted to see this, was that we were able to replicate that retrieval extinction effect. The animals that had undergone reactivation, short delay, and then extinction showed markedly reduced reinstatement and spontaneous recovery compared to animals that had either gone standard extinction or extinction outside of the reconsolidation window. So we were really pleased to see this, but we were concerned that for those behavioural data, the sort of standard explanation for retrieval extinction is not the only explanation for why you might see that pattern of results. So if we imagine what's happening during training is, of course, that we're consolidating this Pavlovian memory. So we've got this memory in the brain. What we are then doing, of course, is then reactivating that memory, and then with the extinction training, introducing this new information, which according to this sort of standard account of retrieval extinction would then be overwriting the original memory and allowing it to restabilize in the updated form. So I'm going to refer to this as the reconsolidation update account. But it's not the only explanation, because of course these animals are undergoing extinction. So it could be the case that actually this procedure of reactivating, then giving a delay, and then undergoing more extinction training could actually just be facilitating extinction somehow. And if we were to facilitate extinction, essentially strengthening the ability of this extinction memory to inhibit the original memory, then we could still see the same reduction in recovery of the original memory, but without engaging reconsolidation at all. So I'm going to refer to this as the extinction facilitation account. Now, for reasons that I won't necessarily get into too much now, but certainly from fear work that was being done in the lab by Melissa Wood and by Emma Carhill, we were inclined to believe that the extinction facilitation account was something that we needed to take seriously. So one of the things that we wanted to do was to try and see, first of all, whether we could get the same sort of behavioural effects with a manipulation that would facilitate extinction. And so Tony chose to use the behavioural tagging literature for inspiration. So in behavioural tagging, a sort of novel or arousing event that happens shortly before training can then lead to increased learning for the subsequent training. And quite often this is something as simple as novel context exposure. So what Tony did was to expose animals to a novel context completely different from the self-administration context. So we're not reactivating the original memory, we're putting the animals somewhere completely different, but it's something exciting and novel, and then putting them through extinction. So essentially what Tony did, he's got the same experimental design as he had before, with the addition of a couple of groups. We also included a 1 hour delay group between reactivation and extinction for reasons that will become clear shortly. And then we also included this novel context manipulation, which was 5 minutes of exposure to novel context, 1 hour delay, and then standard extinction training. And then the animals were put through the same sort of tests that they'd been put through previously, cocaine-induced reinstatement and spontaneous recovery. What we found was, first of all, we replicated the retrieval extinction effect. And this was also the case when we had a 1 hour delay, which theoretically, should be the case because that's still within the reconsolidation window. But of course, you always need to empirically check. But interestingly, we also saw that exposure to the novel context, which would facilitate extinction, also led to similar reductions in both cocaine-induced reinstatement and spontaneous recovery. So facilitating extinction can give you the same sort of behavioural output as this apparent reconsolidation update procedure. So to really try and disentangle which one of these was responsible for the retrieval extinction effect, we decided that what we would need to do is to target the destabilization process specifically, because destabilization should only be necessary for the reconsolidation update account, not for the new learning extinction account. I won't go into all of the neurochemical mechanisms underlying destabilization, but suffice it to say there are a number of neurochemical targets that you can use to block destabilization. And the one that we went for was a blocker of L-type voltage-gated calcium channels called nimodipine. And essentially what we reasoned was that if this reconsolidation update account is what underlies this retrieval extinction effect, then nimodipine, by blocking destabilization, should convert retrieval extinction into standard extinction, because that destabilization process can't happen. Now, we also wanted to rule out, although we couldn't find any literature that nimodipine would interfere with extinction, we also wanted to rule out any extinction effects as well. So we also included a manipulation of novel context exposure and standard extinction within the experimental design. So essentially what we did was the same as that previous experiment, but with a 1 hour delay to give us a little bit more time for the nimodipine to wash out before we went into extinction training. But this time the animals are receiving vehicle or nimodipine prior to the reactivation or novel context exposure. So what you can see here are some of the data. And the first thing to say is that, first of all, we replicate the novel context effect, that the responding recovery in cocaine-induced reinstatement is lower if animals have been re-exposed to a novel context. So again, that's a replication of that facilitated extinction. And actually neither standard extinction nor the novel context manipulation were affected by nimodipine treatment. So that's reassuring. We also replicated the original retrieval extinction effect in the saline treated animals. When we gave nimodipine, what we got was a frustratingly intermediate bar, where actually manipulation looks a lot like the novel context exposure, but it doesn't look like standard retrieval extinction, and it doesn't look like standard extinction either. So what I think is happening here, and this kind of comes back around to that point about really getting a better understanding of what destabilization is my suspicion and my job for the summer is to go and see if there's anything in the data that supports this, is that actually, depending on the training history of the animals, that's determining whether some animals are actually engaging in the reconsolidation update account and whether some animals are actually engaging in the facilitation of extinction. And behaviourally, you can't tell those apart, but that might explain some of the variability in the data. And so actually, by trying to understand better the factors and the parameters that underlie destabilization and the boundary conditions of destabilization, that might give us some insight into how we can bias the system towards updating or facilitating extinction. So not necessarily any conclusive stories. A lot of this is still ongoing work, but hopefully what you've seen today is that disrupting the reconsolidation of maladaptive memories does offer a real opportunity for developing new treatments for mental health disorders, but that of course there are challenges that need to be overcome. We need a better understanding of the boundary conditions that underlie memory destabilization, both phenomenologically but also mechanistically. We do need to find ways of manipulating these memories in humans with suitable amnestic agents, although I think that's less of an issue perhaps than it was originally considered to be. And that these behavioural approaches might provide a way of targeting these memories. But really, we need a much better understanding of mechanism if we're going to be able to actually apply these on a much wider scale. So I'll just finish by thanking some of the people who contributed to this work, the funders, and you for your attention. I'd be really happy to sort of hear your thoughts and your questions. So thank you very much.
Amy, thank you for a wonderful talk. That was a wonderful talk. All the complexities and nuances of this research you've clearly portrayed. I mean, from all the early fanfare of reconsolidation theory, you know, the 10 years that have, you know, since, you can see just how difficult this field is, but also the challenges, but the opportunities that may come